with you. For the best information, please go to the CDC. And if you have questions about your health, please talk to your healthcare professional. I just want to start with a few facts about what's going on so that you know. And as of today, March 17th, this is the best information that I have, which all comes from the CDC and from the World Health Organization. The coronavirus has several different names. The one that we know it by the most is the coronavirus, or COVID-19. Um, this started recently. January 30th is when it became an international concern, according to the World Health Organization. And just a few days ago, the President of the United States labeled it an outbreak, 2 days after the World Health Organization labeled it a pandemic. There's still a lot that we don't know about this virus, and we know that China has not been forthcoming with all of the information that it has. Our government and scientists do believe that this is not going to threaten the global population, meaning this is not the end of the world. Not everyone's going to die on the planet because of the coronavirus. That said, though, the government is being very precautious, and we might have some questions about their political opinion in the election year and the validity of the information that they are giving us or why they're giving it to us this way. Um, but this is not a gamble that we can take. Um, we have to take this threat seriously. Um, Symptom-wise, 80% of the people that have the coronavirus don't know they have it. Um, the the symptoms, if you're going to get symptoms, appear anywhere from 2 to 14 days after you're exposed. Most of the time, it's around day 5 where those symptoms appear. And those symptoms are fever, cough, shortness of breath. Um, the the disease lasts about 5 to 6 days. So if you catch the virus, just anticipate about a week. Uh, the severity of the illness, we're not sure. There's a lot that's still unknown about it. And the range of symptoms are very mild, which in most cases, carriers don't even know that they have the virus, all the way up to the symptoms being fatal. China is reporting that it believes that about 16% of the cases are either very serious all the way to fatal. Um, so we're not sure uh, how this is going to develop in the weeks to come, but it seems to indicate that about 16% or less are going to seek health hospitalization. Um, it is more dangerous than the common flu. That's a fact that's kind of going around, that it's not as dangerous as the common flu. Um, the fatality rate for influenza is about 0.1% globally, and the fatality rate for coronavirus is 3 to 4%. So it is more fatal, um, but you can take that statistic for what it's worth. Just one thing that I think is important to talk about and bring up is we need to make sure that as we are struggling with our emotions and our frustration with this virus, that we don't look to blame the Chinese people. I know there's lots of speculations on where and how this virus started, uh, whether it was random or a government organization that planted it. We don't know. But regardless of what your opinions about foreign policy, um, we need to understand that it's not the people of China that caused this problem, and they're going through the same things that we are. And we need to exercise compassion and patience and be careful about the way that we talk about this challenge and this virus, and make sure that we're doing our best to provide hope and also provide the facts of what's going on. Um, the virus is contagious. It transmits from adult to adult, from animal to animal, and then from animal to human adult, and from adults to children. Our current research shows us that children do not give it to adults. Children do not receive it from animals. um, and that animals don't receive it from adults. It is transmitted mostly through contact, although it is an airborne virus. The World Health Organization has said that there is a very low risk from catching the virus from a non-symptomatic person. So if you come into contact with one of the carriers of the virus, one of those 80% that have the virus but are non-symptomatic, don't have any symptoms, there is a very low risk that if you do catch it, that there's a very low risk that you would even catch it to begin with. Um, the people who are at high risk are older adults, people with heart disease, people with health problems such as diabetes, lung disease, people that are immunosuppressed. Um, there doesn't seem to be any data that you can get this from your dog or cat or give it to your dog or cat. Um, and while the virus does live on surfaces, we're not sure how long. Our current studies show anywhere from a few hours to a few days, and it depends on the surface and the climate that the surface is in, which is why the government is telling us to regularly clean common areas and areas that you touch frequently. Um, Regarding packages, people concerned that they shouldn't touch packages, especially packages that come from China. The World Health Organization that there is a low risk from catching coronavirus from packages that came from an infected area or that were carried by someone who is infected. The World Health Organization has deemed it safe to receive any package and not worry about the coronavirus. Um, the virus is spreading currently in the world. There's 185,000 cases, and 75 of those have resulted in death. In the United States, there are 3,500 cases, 58 resulting in death. In California, 472 cases, 11 ending in death. And here in Ventura County, we have one case which was received from someone who traveled outside of the area, and they're in quarantine and they have not died. Our church has been affected. Our district superintendent and our district mission team to Peru are currently stranded in Peru due to travel limitations. And also our Chinese service, many of them traveled to China for the Chinese New Year and now they're unable to return. Let's talk about prevention. If you're sick, please stay home. Wash your hands regularly, regardless if you're sick or not. Cover your mouth when you cough or sneeze, and clean surfaces and areas where you touch them a lot. There are many things, places that are shutting down, and this is try to prevent the disease from spreading. Also, avoid touching your face if you can, and try to stock up on needed cleaning supplies, food supplies, and dry goods. Uh, People have really panicked in this area and tried to buy everything. The point of this is just limit the amount of times that you're going out into public to be around people. You don't need to buy everything that's on the shelf. Social distancing is a term that we've started using to remind ourselves to keep a distance from one another to keep the virus from spreading in case the person you're around does have it and is non-symptomatic. The World Health Organization recommends 3 feet. State of California recommends 6 feet. The reason for it, you can tell by this diagram with the matches, is by one person practicing some healthy spacing can really slow down or stop the spread of the virus. President Trump has recommended gatherings be limited to 10 people or less. And I believe that we need to respect the authority that's over us. This past week, in my message, I shared this verse. It said, make the maker, or God, proud of you by being good citizens. Respect the authorities, whatever their level. And I believe that when it's appropriate, when the laws do not challenge the Word of God and the kingdom of God, that we should do our best to live peaceably and to respect the people that are over us. When we honor Gavin Newsom and Donald Trump, we honor God. When we respect the men and women that are leading us, we show respect to God. And I have been doing a lot of praying about how do we respond and what do we need to do and how do we participate in the many closures that are happening and if we should participate. I've asked our board, our staff, our ministry leaders what they think. And after great consideration, here is our plan. We are postponing or canceling our events. This includes our annual celebration that's coming up. We're canceling our classes and small groups. If your small group is 10, that's the limit. So we just need to cancel those. We're postponing our voting. We'll have our church election when it's safe to do so. And we're moving all of our services online. And we're going to have what's called a soft open. And here's what that means. I recognize that community is so important, and I recognize how much we need each other and the value of physical presence. And I also recognize that we need spiritual encouragement. So if you are healthy and you are under the age of 65, the church staff will be on Sundays at 10:45 at the church broadcasting our service live, and you are welcome to join us. We would just ask you to practice the healthy recommendations that we're sharing in this video and that our government is sharing with us on how to slow this spread down. This vision that God gave us to be digital and have a video presence online has prepared us uniquely for this moment. It took months of us perfecting the kinks and working through so many challenges of getting our services online. And now we are completely ready to do this. And I thank God for His vision and how He has uniquely prepared us for this season. We're also committed to supporting our friends that meet in their Anon groups at the church, and we have left it up to them if they would like to meet or not. And our facility is going to remain open for people who are so dependent upon these group meetings. If you're sick, this is self-resolving. In 5 to 6 days, it will take care of itself. If you are sick and you do think you have the coronavirus, you need to call your healthcare professional so you can get tested. This helps the people over us, our leaders and authorities, understand how the virus is spreading and who's at risk. You also need to stay at home. 20% of the people that have the coronavirus do require hospitalization. So if your symptoms worsen, you need to seek emergency care, and you need to call before you go in. And here is the solution. Here's what's happening with the coronavirus. There are at least 20 vaccines that are currently in testing right now. They need time to finish their testing and to mass produce the vaccine. That's why it's so important that the places and gatherings shut down. It's to allow our researchers and scientists to have time to develop a solution to this. It's hard to see in the picture up there, but we're trying to flatten the curve. The red image is the image is we just ignored all of the government's recommendations and went on with life as normal. The virus would spread rapidly. And you can see this faint line that goes just above the top of the blue hill and cuts right in the middle of the red hill. That is the level of resources that our healthcare industry has. The amount of beds, the amount of ERs, the amount of hospitals that are able to care for people who are sick. If we do nothing, our hospitals are going to be overwhelmed. If we do all these things, the point is that we can allow we can slow the spread of the virus. It'll give our researchers time to develop a vaccine, and it will space out the beds that are needed and the resources needed for other patients, especially the patients that are very much at risk with this virus. The test in the state of California is to call your healthcare professional. There are private labs that are developing their own tests, but currently the state of California has recommended you to wait, call your healthcare professional, and set up a time for you to be tested through them. I want to share with you right now a unique challenge that we're facing. CamNaz is under a financial strain. Before the coronavirus hit, we were $12,000 in the red. And with the coronavirus hitting, I'm very much concerned that we need to take some proactive measures here. We need people to give. As a church, we have been praying over this situation and trusting the Lord over it. But we really need you to consider participating and being generous and supporting the church through this season. We would encourage you to give online. Go to camnaz.org and click on the word at the top, give. Or you can text an amount to 84321. And we're also hoping to get a link set up where you could text giving to 24587 and get that giving link also shared to you. You can also drop your gift off at the church mailbox. We also have people in our church that are sick. They're not sick with the coronavirus, but we need to remember them as we are practicing being safe and being socially distant. We also need to not be relationally distant as well. And we need to make sure that we keep our connection on. This is a season of incredible opportunity. It's an opportunity for us to be generous, not just with the church, but we're seeing people panic in buying hordes of goods in stores, and now more than ever is a great opportunity for you to share with people in need, to share with your neighbor when they need sugar or milk, or if they run out of toilet paper because they can't buy any in the stores. We're also seeing people that are in this crisis. They're seeking faith. They're seeking hope. They're seeking courage. And they're seeking connection. Now is a great opportunity for you, church, to reach out to your neighbors and share the good news. We want to invite you to join us in praying for this. We believe that prayer is powerful, and we believe that we can make a difference in prayer. And we would invite you to pray with us that this virus would end. We're also going to be focusing on our digital church content and sharing that with you. And we would love for you to join us. The easiest way to do that, again, is go to camnaz.live. We're also going to be working around the clock to share with you content for you to share with your families. During the season of us trying to, things shutting down and us being alone with our families, it's a great opportunity for you to share meaningful connection with your families, and we want to provide you with resources to do that and to do it well. We're also working on trying to share resources with our community as they need them, and we'll get that information out to you. And I'd also encourage all of you to stay connected digitally with your small group. In fact, small group leaders, I am asking you to reach out to people in your small group every single day just to see if they're okay. And if you're in a small group, please reply, and reply quickly, whether it's answering the phone or sending a text, that you're okay. We want to make sure that people aren't isolated in their homes and hurting and needing help and no one knows it. If you need more information, I would again encourage you go to the CDC website or go to the World Health Organization website. Thank you for listening, and stay encouraged and stay hopeful.